Hi, I'm David Mack III with another edition of the Committee on Better Racial Assurance Sickle Cell Anemia Empowerment Program information. Information, as we always say, not only for sickle cell patients and their families, but information that all of us can use. Sickle cell anemia is a chronic disease, and that's what we're going to talk about today. Chronic diseases, and some of the things that we can do to deal with that. And this is going to be the first part of a two-part series, Steps for Coping with Chronic Disease. And again, this is part of the COBRA Sickle Cell Anemia Sickle Cell Empowerment series. But again, as I always say, everyone can benefit from this information. Chronic disease defined. Chronic disease is a disease that persists for a long time. Does not end. Chronic diseases generally cannot be prevented by vaccines or cured by medication, nor do they just disappear. They just don't end. What is sickle cell disease? According to the Center for Disease Control, it is a group of inherited red blood cells that will sickle red blood cells disorder. The red blood cells become hard and sticky and looks like a C-shaped farm tool called a sickle. Thus it's called sickle cell anemia. Sickle cell can get stuck in small blood vessels and block the flow of blood and oxygen to organs in the body. These cell changes can cause repeated episodes of severe pain, organ damage, serious infections, and even stroke. Sickle cell disease affects millions of people worldwide and particularly common among those whose ancestors come from sub-Saudi Arabia, regions in the Western Hemisphere such as South America, the Caribbean and Central America, Saudi Arabia, India, and the Mediterranean countries such as Turkey, Greece, and Italy. So Italians, Greeks, East Indians, people of other ethnic groups besides African Americans can get sickle cell disease. The pain and aggravation of a broken bone, burst appendix will end. It will heal in time. Not true for high blood pressure, heart failure, diabetes, and sickle cell disease, which are chronic conditions. So again, chronic conditions will not end. Not like a broken bone, having a cold, some of those types of things, having the flu, even having pneumonia for an otherwise healthy person. Those events, those diseases can come to an end, not sickle cell disease. So what are some of the things that we can do to manage our sickle cell disease? Again, with chronic diseases, what are some of the things we need to know? What are some of the things we need to do? And again, I'm going to give you 10 things on this series. We're going to go through 5. You need to tune in next time to get the other 5. First and foremost, get information. Ask questions of your doctor and nurse. Write your questions so as not to forget what you want to ask when you see your doctor or nurse. And you should have a physician and nurse that's willing to communicate with you and capable of communicating with you. Find trusted, and that's the key word, is trusted information on the web from scientific medical sources. As all of us should know, everything on the internet is not true. So you want to make sure, again, you're getting trusted information from scientific and medical sources. Do not look up any sources. For health and medical conditions, search information from such sources. And again, these are some of the things that you can discuss with your doctor and your nurse. All your healthcare professionals should be having open communication with you. Number 2, you want to be able to help your doctor. Listen to your body and track changes. Keep a check on your blood pressure, your pulse, your weight. With sickle cell disease, keep your body temperature not too hot and not too cold. Adjust the temperature in your home environment so you do not help a cold turn into a more severe condition as pneumonia or flu. In other words, you want to be able to monitor your body and your environment. And if there are any changes, something seems out of whack, your blood pressure, pulse, anything of that nature, again, go back to number 1, communicate with your doctor. Number 3, build a team. You might speak to a nurse about stop smoking and start exercising, stop or not consume alcoholic beverages. The best nutrition information is from a dietitian. Select healthy foods. Do not eat a lot of sugar, fat, sodium, which is a scientific name for salt. We all know what to do. We just have to be disciplined enough to do it. Number 4, coordinate your care. A primary care physician or sickle cell clinic physician can put together the pieces to make sure your treatments are good. A team of appropriate specialists. And that's what you want to be able to do. And your physician will be excellent at directing you as to who are the other healthcare professionals you should be seeing. Number 5, make a healthy investment in yourself. Again, it's stuff we all know. We just need to do it. I recommend writing it down. Activities. You've heard me talk about planning tomorrow before tomorrow comes. Writing out exactly what your activity is going to be, especially as it relates to your health. Which developing, again, number 5, make a healthy investment in yourself. Stop smoking. I'm hoping nobody, especially with sickle cell disease, is smoking. Losing weight, exercise, walking for people that have sickle cell disease. Healthier eating, and to not overexert yourself to trigger a painful crisis. Again, if you have sickle cell disease, you have to know your body and you have to understand what can trigger a sickle cell crisis. Again, these are all common sense things, but a lot of times all of us, we know what to do, but we're just not really focused on doing it. So I urge you to, with these things that I've mentioned, write them down. Make a checklist. Make sure you're doing the activities, those that you have to do by yourself, those that you have to do with your physician and your healthcare team, and understanding from a mental standpoint what a chronic disease is. A chronic disease does not mean death. It means you have to do some things to live a productive and exciting life. And so many people do. Again, I'm David Mack III with the Committee on Better Racial Assurance Sickle Cell Anemia Sickle Cell Empowerment Series. Next time, we'll do the next 5. So be listening and be watching. Thank you.